Verden urettferdig. For mange verden utrygg. Forut kjemper mot fattigdom og urettferdighet. Vi arbeider for barns og kvinners rettigheter, og for at rusmidler og dårlig psykisk helse ikke skal hindre trygghet og utvikling. Verden urettferdig, men verden kan forandres.
Ja, velkommen tilbake. Litt kjappe bevegelser på skjermen der, men det gjør jo ingenting. Vi skal over til et nytt tema. Et tema som Ida var innom innledningsvis, nemlig psykisk helse, eller folkelykke. Over 800 millioner mennesker har psykiske lidelser i verden i dag, og 80% av de bor i lav- og middelinntektsland. Så det at psykiske lidelser et i-landsproblem, det tror jeg vi kan bare legge bort i en skuff en gang for alle. Det et globalt problem som rammer alle, uansett samfunnslag og land. Før vi går litt sånn dypere ned i den tematikken, så skal vi ut på reisefot igjen. Og denne gangen så skal vi til det sentrale Afrika, nemlig Malawi. Det et av de fattigste landene i hele verden. Og vi skal reise til jentespeiderne i speiderorganisasjonen Magga. Magga jobber blant annet med forebygging av kjønnsbasert vold og barneekteskap. Landet har en lov mot barneekteskap, men kampen har ikke stoppet der. I tillegg så bistår Magga barn og unge som har vært utsatt for grove misbruk, og som trenger ekstra hjelp. Det mildt sagt ganske imponerende hva de her unge jentene får til. Og vi skal ha med oss Vessi på 18 år, Vessi Banda på 18 år, direkte fra Lilongwe i Malawi. 18 år, og vi i Malawi. Hører jeg meg selv? Og vi i Malawi. Hører jeg meg selv? Just a second, Vessi. We have some technical issues in the room, so we'll just take a test maybe to see if it's still like feedback. No, it's okay. Take a test maybe to see if it's still like feedback. No, it's okay. Okay, Vessi, they are kindly asking you to reduce the volume on your microphone, I assume. The speaker, can you do that? Okay, she says yes. Just give her some second. Should we do a test again or see if it's... Should she mute her mic maybe while I speak? Okay, so we can just... Okay. Technical issues are solved, I see. So welcome. So nice to have you here with us. Can I see? Yes, I can see on the big screen as well, but I will communicate with you here. It's better for me. So you've been a part of Magga since 2010, I think. Can you please tell us a little bit about what kind of work you do there, what kind of activities you take part of, and so on, to share with the crowd here?
Okay, as introduced, I'm Wesley, and since I joined the Malawi Girl Guides in 2010, I've taken part in a lot of projects and campaigns that were led by Magga, and some of which were funded by FORUTs. I've taken part in trainings that talked about end alcohol abuse. I've also taken part in campaigns that where me and my fellow youth are the members of parliament concerning the national alcohol policy in terms of the implementation and all. I've also taken part in trainings and campaigns that talked about end gender-based violence. Time where me and my fellow youth went into and led a peaceful demonstration, voicing out the concerns about the rising cases of rape in the country. So I've taken part in a lot of projects and campaigns that talk about different things, empowering girls, talking about the youth and all.
Thank you. Was the sound okay for you? Because for me, I could really hear her very well, but maybe not for you in the public. No. So I just need to do like a brief translation, because I could hear you really well, but it was like something with the sound, you know, connecting Malawi and Norway. It can be a problem, some problems with the sound and so on. So I'll just say some few words in Norwegian, and then I'll come back to you. Så hva hun har sagt, og som jeg hørte veldig godt, men som kanskje ikke dere hørte, at hun har vært medlem av Magga siden 2010, og hun har vært med på veldig mange forskjellige aktiviteter, blant annet demonstrert og gått i tog for å få på plass en bedre alkoholpolitikk. Hun har gått i tog for å fremme rettighetene til barn og unge som er utsatt for kjønnsbasert vold. Og hun har generelt fått kunnskap om tematikk som rammer barn og unge i Malawi, og fått lov til å liksom finne sine, hva skal vi si, måter da, å være med på å forme samfunnet på, til tross for at hun er bare 18 år. Okay, let's continue. We also asked you if you could share with us some of your, maybe visions for the future, for your community, for your country, and so on, looking, into the future.
Okay, so looking into the future, I do have a world vision where I'd like to see the world which is alcohol abuse free and also gender-based violence cases free. I also do happen to have a national vision where I would like to see the government taking the lead in implementing policies that are there to protect the youth, young girls and women and children. I also do have a community vision where I would like to see the people in the community, the chiefs, the police, everyone just taking part in creating an environment which is safe for all. And I, as a girl child, also do have a vision where I would like to see myself and my fellow girls living in an environment which is safe, gender-based violence cases free, and where girls can just simply explore their potential to the fullest.
Thank you so much, Vizzy. We really appreciate that you took your time and that you shared your visions and thoughts and experiences with us. And me and Anna, we talked about that we are really looking forward to the day when we can meet face to face and not only, through a screen. So have a very good day. Say hello to your fellow friends and colleagues, and see you soon. Thank you. Let's give her a hand. Så jeg regner med at kanskje lyden ikke var sånn superbra på bye. Superbra på det hun sa på slutt her heller. Men først så sa hun at hun ønsket jo et samfunn som var et samfunn som ikke var preget av alkohol og vold, og likestilling mellom kjønn var noe hun ønsket seg. Og så tror jeg hun sa noe som er ganske likt for alle barn og unge i verden i dag. Hun ønsket en regjering som tok ungdom på alvor og hørte på hva de sa, og det tror jeg er ganske likt om du sitter på Gjøvik eller om du sitter i Lillongwe. Så det var jo et godt eksempel der altså på hvordan Magga bygger selvtillit og myndiggjøring hos jenter og unge. Og apropos det, Ane, ikke Anne, så det en annen organisasjon som også jobber med det. Vi skal tilbake til India.
Det skal vi. Og så får vi håpe at dette her Malawis neste president. Det kan jo alltids være, hvis vi fortsetter å arbeide. Men nå det India som gjelder igjen. Vi skal tilbake til vår partnerorganisasjon APSA. De har vært en partner lenge, og de arbeider med barnerettigheter, likestilling og alkohol som utviklingshinder. De jobber i stor grad med å beskytte utsatte barn og unge. De har en krisetelefon, de har krisesentre, og de hjelper med utdanning og helsehjelp til barn som lever i slummen. Og barn som opplever traumer, eller som har det vanskelig, de heles både i kropp og i sjel hos APSA. Og nå skal vi se en video av en jente som heter Almas. Hun 22 år, og da hun mistet moren sin, måtte hun avslutte studiene for å ta vare på henne. Det gjorde at hun gikk i kjelleren, ble deprimert og hadde det svært vanskelig. Og Alma skal fortelle oss litt om hvordan situasjonen var før og etter hun møtte APSA.
Hi everyone, my name is Alma Khano and I'm here in front of you to share my experience with APSA from the APSA classes. Before coming to the APSA classes, the person you see me in front of you now, I'm not the person who was 2-3 months ago. As I was going through the depression from my mom's demise, I was totally distressed. I was about to commit even the suicide. But wherein my friend Sumaya, she suggested me with APSA classes, which is free of cost. And when I came across, like it was free, so I just wanted to join and get my depression out. And I wanted to increase my communication skill and also learn some basic computers like MS Word, Excel, PowerPoint and all. So when I came to APSA, I met my class teacher and the coordinators and also my new friends who helped me who helped me a lots and lots to change me in a very well manner. Now I'm what the person you're seeing me confident, bold in front of you, talking and sharing my experience. It's just all because of my teachers and my coordinators and as well my friends. I thank them. So honestly, in 2030, coming on to my in the world. Let me come first to the world. I want world to give lot of opportunity for the girls like me especially, and also like for the security purpose. Mainly being a girl, I would love especially that my world should be secure for girls and not only girls and even for almost everyone. And whereas I come on to my community and my surrounding personal life, I would love, like I'm being a Muslim, I face a lot of problems like going for the job and mingling with guys and all. They don't allow in my community. They think that's a very big crime going for the job being a girl. And thanks to my APSA coordinator and teacher who helped me, who convinced my parents, for letting me for the job, and they convinced so well that now I'm working it. And I would really love to see that every person changes their mind and sends the girl for the work, especially from my community and also in all over the world. Give the rights to the girls for the education and please not let them get married soon and have kids. Now, girls are not meant only for marriage in 2030. I would love to see that girls are limited to marry only when they are stable of getting married. Thank you.
Tusen takk til Almas for åpenheten. Det ganske tøft å fortelle en sånn historie fra andre siden av verden. Og det jo viktig, dette jo eksempler på historie for hvorfor vi alle sitter her i dag og opptatt av det vi opptatt av. Og de sier at det viktigste vi har mellom ørene, og det viser jo Almas med all tydelighet. For har man mistet håp, sliter man med dårlig psykisk helse, så klarer man ikke å tilegne seg kunnskap. Man klarer ikke å gå på jobb. Man klarer kanskje ikke å ta vare på familien eller vennene sine. Og for fattige uten hjelp til psykiske problemer eller et sikkerhetsnett, så jo dette en fattigdomsfelle. Det ser vi igjen og igjen. Og Almas viser jo også veldig tydelig at psykisk helse handler ikke bare om å utdanne masse psykologer og spesialister. Det handler om grasrotnivå, det å tilegne seg litt kunnskap og bruke den godt. Og det viser APSA hver eneste dag at de gjør. Så det var ekspertene på bakken. Nå skal vi gå videre inn i tematikken. Aller først så skal vi se en film som Forut og SOS Barneby lagde til Arendalsuka da vi hadde et seminar om psykisk helse. Så skal vi få en kort introduksjon av arbeidet vårt om psykisk helse av vår utenlandssjef Ståle Stavrum. Så tar førsteamanuensis ved både Oslo Met og Universitetet i Bergen, Ragnhild Dybdahl, over stafettpinnen. Og i hennes panel så sitter Ståle Stavrum, Cecilie Javo, som da barnepsykiater og forsker ved Samisk Nasjonalt Kompetansesenter, psykisk helsevern og rus, og vår faglige rådgiver over en god stund nå. Så har vi dr. Arun Kunwar. Han leder av det første og eneste barnepsykiatriske klinikken i Nepal. Og så har vi Sumnima Tulladar, som da leder for vår partnerorganisasjon i Sivin. Så bare holde seg fast. Nå skal dere gjennom en spennende og interessant del. Vær så god.
Hvert 40. sekund tar en person livet sitt. Dårlig mental helse fører til selvmord over hele verden. Vi må satse på global mental helse. Har vi glemt det i utviklingspolitikken? Allerede før menneskerettighetene ble underskrevet i 1948, gjorde Verdens helseorganisasjon det klart at helsebegrepet også inkluderte mental helse. Her hjemme i Norge psykiatriens historie over 150 år. Vi skal ikke så langt tilbake før vi famlet i blinde og eksperimenterte med livene til psykiatriske pasienter. På 1800-tallet ble det satt opp sinnssykehus og asyl. Lav kunnskap om mental helse resulterte i overfylte asyl, isolasjon, tvang og overgrep mot syke mennesker. De aller fleste svært fattige. På slutten av 1960-tallet og begynnelsen av 70-tallet ble mer humane og virkningsfulle metoder tatt i bruk. Nå jobber vi med forebygging av dårlig mental helse og med riktig behandling for de som trenger det. Vi har kommet langt i å opparbeide kunnskap og fjerne stigma. Vi ser hele mennesket, og det noe vi kan eksportere. Rundt 800 millioner mennesker i verden har mentale lidelser. 80% av disse lever i lav- eller mellominntektsland. Hele 80% av disse igjen mangler tilgang til mental helsehjelp, og det et økende problem. I et globalt perspektiv mental helse fortsatt et neglisjert og stigmatisert område av medisinen. Mennesker med mentale plager opplever en økende grad av marginalisering. Mentalt syke fratas rettigheter, legges i jern, bindes til trestammer, jages ut i skogen eller befris fra onde ånder med vold og bønn. Dette grove menneskerettighetsbrudd. Vi kan bidra med kunnskap til avstigmatisering og alminneliggjøring av mentale helseutfordringer. Få land har større åpenhet rundt dette enn Norge. Vi kjenner til hvor galt det kan gå om de mentalt syke blir behandlet feil eller ikke får behandling. Innen 2030 vil mentale problemer være den vanligste årsaken til for tidlig død. Verdens helsebudsjetter henger ikke med på utviklingen. Dette kan norsk utviklingspolitikk gjøre noe med. Ved å fjerne stigma og gi informasjon til helsesykepleiere kan man gjøre en stor forskjell. Forebyggende arbeid redder svært mange og bidrar til at flere får utløst potensialet sitt, som i Peru der SOS Barnebyer holder foreldrekurs og gir psykologisk rådgivning. I Nepal har FORUT og lokale partnere bygget landets første barnepsykiatriske klinikk. Senteret når ut med hjelp og kunnskap om barns mentale helse til helsearbeidere og foreldre i hele Nepal. Mental helsehjelp kan for eksempel bidra til at en voldsutsatt jente klarer å få seg en utdanning. Eller at en mor som har mistet et barn til underernæring ikke gir opp et annet. For mennesker som ikke har noen ting igjen, kan slik hjelp gi styrke til å ikke gi opp og fortsette å stille opp for sine nærmeste. I løpet av denne filmen har 7 mennesker tatt livet sitt. Alarmen går, og vi har ingen tid å miste. Ved å satse på mental helse kan vi redde flere.
Hello, good afternoon. I'll continue this session in English. I'll just say a few words to start us off before we go for a panel discussion. Why should FORUT also start focusing on mental health? We have heard so far about our engagement on the alcohol side and what is motivating us there. Well, we in FORUT, we believe that the engagement on mental health is actually a natural extension of what we have been doing all along. It takes things further. There is, first of all, the simple fact of the thematic overlap between alcohol issues and the harm caused by alcohol and mental health issues. This was recently highlighted in the Auditor General, Riksrevisjonens report on mental health in Norway, where they pointed out that we in Norway are failing in dealing with the combination of alcohol issues and mental health issues, especially amongst young people. What motivates development organizations like FORUT is to take part in the long struggle against poverty and insecurity and indignity and violence and violations of human rights. That is what we are about. Secondly, we are about understanding how societies deal with issues, how we deal with problems. And the insight we have is that very often societies, cultures, nations, people deal with issues in ways that actually are causing harm. Because there are better ways. There are better ways of dealing with issues. This is what we have been saying all along on the alcohol side, and this is what we are seeing on the mental health side. So our motivation is that also in the field of mental health, a lot of the suffering that we see there with women, with teenagers, with children, is unnecessary. Mental problems is something that will be there, but it can be made worse by society dealing with it in the wrong way. And dealing with it in the wrong way, such as with stigma, with trying to hide it, trying to avoid it, only makes things worse. So this, for us, is about unnecessary suffering. And to prevent that, we need to engage, we need to see the issue clearly, and we need to use the best knowledge there is. Because wherever they are in the world who are suffering from mental health issues, they need a better deal than what they are getting now, where they are suffering due to superstition, wrongful beliefs, stigma, and simply fear. People want to run away from mental health because it's difficult and it's scary. The concrete motivation for why FORUT started engaging in Nepal was, I'll not go into the whole thing, but basically the core of it was this, that the opportunity came for us in FORUT and CWIN to deal more seriously with mental health. That is to say that we got in touch with professionals, professional expertise from Norway who had an engagement in Nepal, and they wanted to come in and make a difference in Nepal. And when I spoke with CWIN, our counterpart in Nepal, they wanted action. Why? It was because CWIN, our partner over, well, since 1994 actually, have been engaged in rescuing children from desperate situations. Many of these children were deeply traumatized. Many of them had been very vulnerable to start with. Some of them were vulnerable due to mental health issues, neurological conditions, physical things that actually made them more vulnerable, which meant that they were often taken more advantage of and mistreated more. So they're given the worst possible deal, and society deals with them in a way which harms them even more. So CWIN had been rescuing traumatized and damaged children from desperate situations for a long, long time, and had come across the problem they had nowhere to turn to get the kind of professional advice and professional help on how to alleviate this suffering, how to make the situation better. So CWIN had been banging on the door of the government, do something, take action. But the realization was that, okay, a civil society organization can only do so much, and sometimes a civil society organization has to take responsibility and go in front. And that is what CWIN did. So FORUT and CWIN, together with Norwegian psychiatrists and Norwegian, as we will hear later, Norwegian development community and gradually Norwegian politicians are now coming together to actually do something. So we think this is very right. We think this is very appropriate for FORUT. And we believe that dealing with mental health is definitely an important health and development issue. And it is really a global issue. So I think I will stop there and hand over to Ragnhild, and we'll start the next part of the program. And Cecilia, you can join.
Thank you very much. Can you hear me?
Yes.
Yes. Wonderful. Thank you very much for the invitation to join.
We have to wait for Sunniva. We are going to connect Sunniva as well. Let's see if we can have her.
Sunniva is waiting in a waiting room. Last time I talked to her.
No.
She might have the wrong link.
Yeah.
So Sunniva is going to log out and log in again.
Yeah.
Thank you very much. Thank you very much, Ståle, for the words you just said, which the introduction on why FORUT has decided to engage in mental health. And thank you very much for inviting me to be part of this celebration of FORUT's 40 years of fabulous work. Let me start by congratulating you and everyone who works for FORUT on your continued efforts and your great results, and for your commitment to continue. I'm very honored to be on your panel today and to be allowed to chair this panel with such distinguished guests. We will have three very well-informed and very distinguished guests speaking later, so I'll try to make my introduction very short. I'm a psychologist and a researcher, and I worked in development cooperation since 1989, when I started my first visit in Somalia in 1989. And since then, I've actually more or less been involved in global mental health work in one way or another. So it's really an honor to be part of this panel. And what you said, Ståle, about why FORUT has decided to engage makes such perfect sense to me. And with the film, we also saw you established very clearly the need and then the gap and also the importance of health and mental health. If we are to achieve poverty reduction, if we are to achieve education, if we are to achieve climate adaptation, we will need human resources. Human resources depend on mental health. Mental health is not only absence of serious disorders. Mental health is actually being part of community, be able to resist and shocks, to be able to adapt to changing society, to be able to contribute to work and communities. And therefore it is a prerequisite, and it is recognized also. And I think we have a fantastic opportunity right now, partly because FORUT is engaging, which is very important, but also because for the first time, mental health is recognized on the global agenda in the Sustainable Development Goals by all countries. From the Norwegian side, including mental health in the strategy for non-communicable diseases was a very encouraging and big step forward. And in fact, the corona situation gives us another opportunity. Partly because it's really lifted the importance of mental health, not least amongst young people who've been so affected so harshly, lifted on the agenda, but also because we've got new tools. We've seen ways of working, and telehealth has expanded, and the importance of social support and cultural adaptation and people actually agreeing, finding it acceptable what everyone is offered, and that has become very evident. So we have a golden opportunity right now. You also mentioned how underfunded mental health care has been and is, and that is very, very clear in low-income countries. Less than 1% of health budgets actually are allocated to mental health care, and in most low and middle-income countries, the vast majority of the mental health budget goes to tertiary care, to specialist clinics, which are far from where people are. So if we are to have success, to change this, we need to do something that we haven't done before. We can't just do more of the same. And that involves seeing that this is a truly global issue. As Vikram Patel says, when it comes to mental health, all countries are developing. There is no country that has sorted out mental health. It's not like, in Norway, where we spend a lot of money on mental health care, that we've sorted it out. And we have a lot to learn from, for example, from Nepal when it comes to innovation, when it comes to involving communities, and when it comes to cultural adaptation. Cultural adaptation is not something you do in another country far away. It's what you have to do if you want to meet people where they are. We need to move away from narrowly defined diagnoses. We need to meet people where they are, as close to their homes as possible. This is universal healthcare for everyone, wherever they are, in a way that's acceptable to them. And this involves communities to a much larger extent than we've done before. And it involves lived experience to a larger extent. And the people themselves and the communities get to lead in designing how care should be done. And mental health has to be integrated across health sectors. Having said all this, Dola, is there anything you wanted to add to this general introduction?
I like that global, large picture summary there. Excellent.
Thank you. Then I would like to just move on so that we have a little introduction from each of our three speakers. And I'd like to start with you, Samina Tuladar, who's the Executive Director of Child Workers in Nepal Concerned Center. And you have a lot of experience and you have a lot of passion for this topic. So I'll give you just a few minutes. I'm going to sit here with my watch and be as strict as I can, and so that we all get to hear a little bit from each of you, and then hopefully some discussion as well. Please.
Thank you so much. Namaste, everyone, and let me congratulate FORUT for completing 40 fabulous years. I feel really, really proud that the organization I work with, Sammen, has such a great working relationship with FORUT, and we're just so proud of the achievements that we have together gained in the field of child rights and children's empowerment. As I was so inspired by what the Madam Chair talked about the world scenario. Mental health is developing in even the so-called first worlds, and we are considered so-called third world. And we're like maybe, just like taking baby steps towards ensuring mental health for the children and adolescents we work with. As it is just beginning to get world attention, the SDGs has acknowledged mental health as one of the global agendas. And in Nepal also we now have national mental health strategy, which includes a child and adolescent mental health. So much to do here. And at least now we have, since 2015, children and adolescent psychiatry and mental health got started in Nepal after Dr. Arun, who is a panelist here, and we're working together, and he came back to start Nepal's first ever and the only child psychiatry and mental health service in Nepal. And it took us a disaster earthquake in 2015 to realize that there is a lack of child psychiatry in Nepal. Imagine how much our children and adolescents must have suffered throughout these years. And Sammen, being the frontline organizations working directly with children, directly with the grassroots from, all over the country and from all 77 districts, we have suffered with children. We have suffered with young people who have gone through violence, who have survived sexual exploitation, who have survived trafficking or child marriages. And we suffered with them because they never received any proper treatment. With children, we used to suffer because we felt helpless. How do children get help? How do their issues get recognized? How do adults and policymakers become sensitive towards their issues? And it took us several years to have child and adolescent mental health being at least recognized as a part of mental health in Nepal and as a part of child rights in Nepal. We have been lobbying hard. We have been pressurizing all the stakeholders possible, going door to door to the ministries, to stakeholders and adolescents, because they were starting counseling, this and that. But as Professor Ranghill again said, that we have to go where the children are, we have to go where the young people are, nooks and corners of the country, and especially we are such a geographically challenged country. The hills and Himalayas and the roads that leads to the villages are so harsh. And just by having a centralized system will never ever work here. That's why we wanted outreach, outreach, and outreach. And we're so proud. During these years, our team, which we run at the Country Children's Hospital, provides outreach services. And you know what? During this pandemic, our doctors were able to reach out to thousands of children, and we were able to mobilize young people, adolescents, and at least get them to understand that they have rights to their mental health, and then get aware of their mental health and seek help when needed. That's why we also even started Nepal's first toll-free hotline number for children and adolescents. And during the pandemic, we were able to reach out to more than 40,000 young people from all 77 districts. So I'm so glad that Professor Ranghild actually acknowledged that we have to be where the children and adolescents are. And we are on a right path, and we can, never thank enough our dear partner FORUT for being our rock-solid support in our work to initiate child psychiatry and mental health in Nepal. Thank you so much.
Thank you so much, Samnima. This is very inspiring and very, it gives me a lot of questions and things to ask you. So I hope we can get back to you there soon. But in the meantime, I also very much look forward to hearing from you, Dr. Arun, because you have already been introduced by all of us in a sense, because you have played such a major role. But as the leader of the child and adolescent psychiatric clinic at the Children's Hospital, you're in a very central position, and I know you're a very cherished partner to many. So please let us hear from you.
Yeah, you're muted.
Namaste.
Namaste.
And welcome all. Congratulations to FORUT for 40 years of dedicated and life-changing work for many children and a lot of people. Now, my name is Dr. Arun Kunwar. I'm a child psychiatrist. I go along, how will I put it? We have a long lineage of mental health in my family. My father is the second psychiatrist of Nepal. He got trained in UK and got back in 1968 and started a mental health treatment in Nepal. So I got back from US in about 10 years ago. When I was starting and talking about child mental health, it was very hard for people to conceptualize that children can have problems. There was a clinic that ran at the time once a week at the teaching hospital. In 1 year, they had seen about 40 children. This last year, even with all the COVID and stuff like that, we have seen more than 3,000 children. So, and one of the big credit goes to our partnership with Norwegian Psychiatry Association Transcultural faculty, with the CCL being here, with in collaboration with the CCL and help from, seed money from CCL, we were able to start, along with Sammen, the first full-time child and adolescent psychiatry clinic at the Country Children's Hospital. It is a government hospital, and it has been a big help, especially with the FORUT being added partner. Overall mental health in children and adolescents have been highlighted in Nepal now. People do talk that children can have issues, and in fact this last year we were able to work with the government of Nepal in collaboration with Sammen, UNICEF, and we have developed a community mental health package that has been approved by the Ministry of Health. So one of the big push and all this is our Norwegian partners, and especially thanks to CCL, Norwegian Psychiatry Association, FORUT. And one thing I realized is, when I used to go to the government, Ministry of Health and different agencies and talk about health issues, a lot of time it's hard for people to understand, because a lot of our ministry and a lot of their funding are foreign government based, multilateral, unilateral, WHO, UNICEF. Now, when the partners start talking ministry will start listening. So now they are seeing that, okay, some of the partners are talking about mental health. So we have been engaged with the government, and we were active in formulating a national mental health strategy. And this is the first time that there is a special children's section in every aspect of mental health strategy. WHO's special initiative through Norway, NORAD, on non-communicable disease and especially on mental health, and picking Nepal, has suddenly brought out a big focus on mental health and non-communicable disease. But there was a special clause where it said that you have to highlight the child and adolescent mental health issues. So, this is 10 years is a short time in the history of child mental health. But I think what we have achieved in Nepal is monumental task. And I think it will be a big example for a lot of people to learn. And, we are still evolving. We are still providing only one service in a capital city. And, we'd like to expand. There are a lot more to do. And I wish, I could talk for 2 hours and still not finish that. But I think, this collaboration with Norway, and you all guys have been very monumentally critical to achieve this in such a short period. I always had this, that I know I will work through this and I'll achieve this. But it would have taken me 20 years, but you guys have helped and got it in 10 years. So, I couldn't thank you more for this support, and the children of Nepal will never forget you. Thank you so much.
Thank you very much, Dr. Arun. Thank you for your wisdom and your hard work, and I think there's more gratefulness going towards you than towards us here. So we look forward to discussing further with you shortly. But in before that, I would also very much like to introduce child psychiatrist Cecilia Javo, whom Dr. Arun already helped me introduce, of course, through your important work collaborating with Nepal. But you're also an advisor to FORUTs, and you've been a researcher and a child psychiatrist for a long time, and you have a special competency also on the Sami population and situation. So please let us hear from you, Dr. Javo.
Yeah. Well, I'll be short. My background is from the Norwegian Medical Association and the Board of Transcultural Psychiatry and Global Health. I was the leader of that board for 8 years. And in that period, we also had a board member called Suraj Thapa. He's a Nepali psychiatrist living in Norway. He's actually, at present, he's a professor at the University of Oslo. And we wanted to do a collaboration project in a low and middle income country. We chose Nepal because his knowledge of this country. And I asked him, what should we do? What should we decide to focus on in your country? And he didn't hesitate. He said, child and adolescent psychiatry. Because we have no child psychiatrist, we have no child and adolescent services, nothing. We have actually a few psychiatrists for adult psychiatrists. And we have some institutions in adult psychiatry, but we have nothing as to the child population. And that is more than half of the population, he said. Okay, we said, then do it. We do it. And then we got acquainted with FORUTs. And because of FORUTs, this field has improved immensely, and we very much thank them for their efforts. And Ståle.
Thank you.
So what I will want to say is that if one really wants to build a sustainable and competent service in mental health, then we have to include the specialist level, or else it will not be sustainable, and it will not be of high quality, and it will not. The lower levels will almost faint under the burden of their inexperience and no supervision. So it has to be a specialist level as well. And what is needed actually in Nepal is an educational center for child and adolescent psychiatry, not only for the doctors, but also for the psychologists, for the nurses, and for the social workers. And by doing that, if you develop such an educational center, a national center of child psychiatry, then the whole country will benefit. Also the lower levels. It's a very smart strategy. And many countries actually in the world have used such a strategy, including Norway. In Norway, child psychiatry is very much developed. Well, I think perhaps the most developed in the world. We have child psychiatry all over the country, and many child psychiatrists and other specialists. And how did we start? We started with a center of excellence, or a center of competence, Statens Senter for Barne- og Ungdomspsykiatri in Oslo first. So we have a forceful center. And then that center supervised and helped all the rest of the country. And from that, we decentralized the whole service. And that was a very smart strategy. And we have used the same strategy as to the Sami indigenous people. They had nothing. And actually people said that, well, you don't need a specialist service. It's enough with the lower levels. Why should you have specialists? But now we have a national center of excellence in mental health for adults and children and adolescents, and also addiction. And we have now decentralized. First, a center, and we had then many specialists and education, and then we got a workforce, and then we decentralized. And it's very effective. So I really think we should do that.
Thank you very much, Cecilia. You brought up a lot of important issues here that go straight to the center of some of the WHO strategic choices over the years, both the action plan that has just been renewed, that was supposed to go till 2020, that is now prolonged to 2030, for which experiences from Nepal have been central, for the MHGAP program that has also been in use for more than 12 years now, and that really brings up the same issues that you did there. But of course, your examples are very concrete and much easier to learn from. And the special initiative as well. Would you like to talk a little bit about the special initiative of mental health in Nepal and your application, Ståle?
Okay, I'll try to be brief, but one way of saying it is that after we started this work, we have joined hands with a lot of other organizations. We do have a Norwegian network for global mental health, which is a network of development organizations and psychological and psychiatric professionals who have an interest in developing mental health around the world. And we have been together pushing the politicians towards taking this seriously in a development context. And they have done this. The NCD strategy, Strategien for ikke-smittsomme sykdommer, is for the first time taking mental health seriously in a development context. That is part of the Norwegian scene now. Then, the Norwegian government has in its negotiations with the World Health Organization told them that they would very much want WHO's initiative on strengthening mental health to be extended to Nepal. It is what is called the Special Initiative on Mental Health. So there were 6 countries, and then we started our lobbying, and then the government took decisions, and now the 7th special initiative in the world is concentrating on Nepal. And that means resources, that means competence, that means expertise that is being made available to the government of Nepal and to the whole Nepalese context. So, and the idea is to come up with solutions that fit the actual specific context in Nepal in a good way and get a good mix of interventions and a good mix of responsibilities and division of labor between different types of actors. So you have the government and the formal health system, but you also have civil society. You also have other sectors of society that could and should be engaged. And that's the special initiative. So it's a multi-actor collaboration that is the model. It needs to be tailored to the specific country context. And that is going to happen now. There is momentum here. And on top of it all, something we in FORUT and Siwin and Cecilia are very happy about. A little while back, we were contacted by NORAD and asked to submit a concept note for strengthening mental health in Nepal. We were invited to submit this. They looked at the concept note, and they have then said that, okay, 4 organizations are eligible to apply for funds for strengthening mental health in Nepal. 4 organizations have yesterday submitted their applications, and FORUT is one of them. And basically in the application we are trying to do quite a lot of what Cecilia pointed out. so
20 pages.
But in any case, what we are thinking of is that, yes, we need centrally placed expertise to do supervision and to do training and to do research so that things can be properly contextualized, but they have a responsibility out to the rest of the country to mentoring and monitoring and giving advice and building up capacity around the country. And that is the core thing, and that is the role for civil society organizations like ours, like Siwin and FORUT. So we're trying to tie it all together, and we see now that the Norwegian government and NORAD is giving the opportunity, they're taking it seriously, and this is a huge step forward.
Thank you very much, and thank you, and congratulations on handing in your applications. I know it must have been a lot of hard work, and there was a very short time period for writing it. Of course, this brings us to here and now. I think we have a problem if we think there is a competition between specialist services and community-based services. If we think that you have to choose between primary health, secondary and tertiary, because the paradox is that, and this is the experience from many countries, that the need for specialists does not become less when you have more community-based and services, and when you have promotion activities in the community. It's the opposite, because as Samnima mentioned, it's not only a matter of the supply of services, there's also the demand. Then people say, well, I need supervision, that we need more training. And from the MH gap, from which Nepal has been one of the countries where there's been most research and experience, which is a program for scaling up and getting services closer to where people live. One of the problems with sustainability has been that the specialists do not support or supervise enough, partly because there aren't enough, and partly because they, until now, haven't had this understanding to the same extent as Dr. Arun was just saying, that you really understand and this is happening now, but there's been too much of a split between these primary healthcare, secondary and tertiary. And of course, most things have to happen very close to where people live, in their homes, in the kindergarten, in the school, in their workplace. That's where most things happen. But if we don't have, as you were saying, the support and the knowledge and the skills for the knowledge-based expertise, then it is not sustainable. It doesn't work. It runs out. So if we manage to get away from this competition, and see that we all need it, maybe we have a way to go forward. What do you think about that, Nima? Or is that a wrong conception?
Yes. So a country like Nepal, where we are struggling to get, the fundamental rights to children and adolescents at their doorsteps. We still have many challenges in mechanisms which is supported by the state. That is why the collaboration we have with FORUT is unique, because we are not just doing it as a project which will have, it's timeline for 3 or 5 years. We are thinking of a vision for many years. This initiative will work until the children exist here, because we wanted to institutionalize this. We wanted to, build, institutional capacity of the government institution, rather than doing FORUTs project for 5 years in one of our, areas. We chose Kanti Children's Hospital because it is the only national children's hospital. And if we had this as a project with any other partner, it would have served few thousand children, and it will, die its own death. I'm so sorry. Yeah. But, what we've started here has a vision for a long time, and it is going to stay here. And that is why we need the kind of commitment from the authorities, and for that we are working very hard day and night to get the Ministry of Health and Population on board, because this is such a unique initiative where we are, as a civil society, being recognized by the government of Nepal to run this psychiatry unit within a government institution, which is very rare. And so that also signifies the importance and government of Nepal has given to child and adolescent psychiatry. But so many challenges are ahead with us, because we had to start from scratch, and the government also needed to think through and have MOU with us, and having partners from abroad Cecilia and FORUT coming on board, and having the experts like Dr. Arun and his team on board. So they also need now to gather, I would say, not only commitment, but investing in child mental health. And that's what we are hoping for in coming days, and we will really work hard towards advocacy and lobbying. Thank you.
Thank you very much. Thank you so much. But we're running out of time, unfortunately. But Dr. Arun, I would just really like to hear if you have any reflections or comments on what has been said so far by others.
So I'll get back to your question of, there is definitely a need to develop, specialist services, and that's what we are working on. We are planning to establish a training center at Kanti Children's Hospital. But at the same time, you cannot leave the community behind. Yeah. So in fact, we have developed a child and adolescent MS gap. So it's an MS gap that is only focused specifically on children. So this is a first such model that we have developed, and nobody has it in the whole world. And this package has been approved by the government of Nepal. So, you need to go the two-prong approach. You have to go to community, you have to go to schools, You cannot leave the children behind hoping that, you'll get to them in 10 years. So, we are taking this central approach where we need to develop expertise, develop manpower, then able to train more people, send them to community. They'll be able to supervise and do stuff. And we are also doing a lot of telemedicine. In fact, we have developed this, management of stress for children during COVID. And that training has been done through the tele-video. And we have already reached more than 30,000 children and 30,000 parents and caregiver and teachers. So, there is no one model that fits all. We have to evolve as the time evolves, and with the rapid adaptation of technology as well as expertise. And at the same time, we have to understand that culturally we are a little different than where you guys are or where these models are developed all over the world. So we have to learn to adapt it and make it acceptable to the people. So, all right, I'll stop there. Thank you.
Thank you so much. I would really like to go on for a long time because I have a whole list of questions and many. I know that you have so much experience, but I have been asked to finish by now, so I am afraid I'll have to do that. But it was important to get to hear from all of you, and I'd like again to congratulate you all on the cooperation and on look forward to future cooperation as well. Thank you very much.
Thank you all.
Thank you.
Thank you.
Tusen takk til alle i panelet. Og nå vil jo Cecilie, hun fikk ordet en gang dessverre bare, men hun vil jo være her, så jeg håper dere benytter muligheten til å snakke mer med henne om dere har noen spørsmål. Jeg har ikke spurt om det greit, men jeg regner med at det i orden. Denne historien om Nepals første barnepsykiatriske klinikk, den gir meg alltid gåsehud, og det gjør den også i dag. Og jeg tittet på Therese, og det var faktisk et par tårer som rant på siden. Og det tror jeg vi skal innse at dette noe vi alle kjenner oss igjen i. Dette noe vi alle vet noe om. Vi alle noen i nærheten av oss, eller oss selv, som har opplevd disse tingene og har hatt behov for hjelp. Og dette senteret, denne klinikken, ringvirkningen av den tror jeg kommer til å gå høyt opp i de dype fjell og møte barn der, og dypt inn i de mørke skoger. Så jeg håper, og vi tror, at dette virkelig skal gjøre at verden blir et litt bedre sted. Og nå har vi kommet til veis ende, Therese, og jeg sa jo litt at du gråt et par tårer, men det noe annet du kommer til å ta med deg fra dagen i dag?
Ja, altså nå har jo du avslørt at jeg har blitt sånn fan i den klubben til Eva og Øystein. Jeg jo litt sånn preget av at jeg har jobbet mye med politisk påvirkning tidligere. Så jeg liksom helt overbevist om at vi kommer til å få på plass et globalt rammeverk på alkohol, på lik linje med tobakk. Det handler jo bare om å ikke bare liksom ha rett, men få rett, og danne allianser og bare kjøre på, tenker jeg. Men utover det så det jo alltid, tenker jeg tilbake til det som skjer hos organisasjonene våre på bakken, de som står i det her hver dag. Og da det jo særlig personer som Bessie og Almas som stjeler min oppmerksomhet. Det det. Det både inspirerende og motiverende og forpliktende å høre og se på de. Så, og ikke minst det siste innslaget her også. Så det mye. Men nå, folkens, nå vi snart ferdige her, og da må vi be dere forlate salen. Vi skal rigge om. Vi skal ha festmiddag om et par timer. Så, men da dere hjertelig velkomne til FORUT-kontoret. Det bemannet, og der skjer det ting. Og så møtes vi her igjen, det 5:15, tror jeg, at vi åpner. Og så var det noe mer dagene. Vi skulle takke for oss, og så skal vi gi ordet da, til nåværende. Vi må jo ta et lite sånn understrekning under nåværende utviklingsminister Ulstein. Skal få siste ordet her i dag. Ja.
Takk for oss.
Takk for oss.
Da er det utrolig kjekt for meg å kunne gratulere FORUT med 40 år. Gratulerer også til eierne av FORUT, IOGT, Juvente og Juba. Alle som har hatt bursdag under pandemien vet at det ikke alltid har vært like lett å feire sånn som en ønsker. Men stolte og takknemlige kan vi i alle fall tillate oss å være. Dere har utrolig god grunn til å være stolt over resultatene som FORUT har oppnådd gjennom de 4 tiårene. Som utviklingsminister så er jeg veldig glad og takknemlig av akkurat samme grunn. 6 millioner mennesker i Asia og Afrika har fått direkte hjelp fra FORUT og partnerorganisasjonene. Hjelp til skolegang, til yrkesopplæring, til helse og nødhjelp. Dere har hjulpet kvinner, barn og marginaliserte grupper. 2 millioner barn og unge har deltatt i FORUT sine kampanjer, og dermed også fått kunnskap om bistand og anledning til å vise solidaritet i praksis. Det betyr utrolig mye. Det ligger en sånn utrolig viktig verdi i nettopp det. Så skal dere ha anerkjennelse for å ha bidratt med mer enn 1 milliard. 1 milliard kroner til prosjekt i utviklingsland. FORUT sitt arbeid med rusproblem, psykisk helse og ikke smittsomme sykdommer er også en utrolig viktig og for god og trygg utvikling. I 2019, det opplever jeg så lenge siden nå, men i 2019 så hadde jeg veldig stor glede av å besøke barnerettighetsorganisasjonen Child Workers i Nepal. En av FORUTs partnere fikk se det som nå har blitt Nepals første barnepsykiatriske klinikk, som da var under bygging. Dette vet jo dere bedre enn meg om dere kan mye mer om det, men jeg kan virkelig tenke meg at det gode, langvarige partnerskap med lokale og nasjonale organisasjoner har vært en viktig nøkkel til at dere har lykkes så godt med prosjektet deres. Og det samme vil jeg tro er tilfellet for den helhetlige tilnærmingen som FORUT har til sitt utviklingsarbeid. Samtidig som FORUT fyller 40, så nærmer vi oss 2030 og deadline for bærekraftsmålet. Pandemien har jo gjort det på veldig mange måter vanskeligere å nå målet, men ikke mindre viktig. For skal vi lykkes, så trenger vi partnere som FORUT. Og måten dere jobber på er den rette veien å gå for å komme i mål. Vi må nå de aller svakeste og mest marginaliserte. Vi må tenke helhetlig, og vi må samarbeide. Så igjen, takk for at dere er med og drar verden i riktig retning. Og lykke til med de neste 40 årene.